Hey, Dave O'Sullivan here again. Now in today's training I'm going to cover what to do when your pain science explanations are not effective with a patient. Now we've all been there, okay, when we give the pain neuroscience explanations that pain doesn't mean damage, etc., and it works miraculously with some patients. For a small portion of patients in my clinic that I see, that's all they need to hear sometimes, okay, and that's great. But a lot of therapists, especially my mentorship and especially the other groups that I coach with, they are very, very frustrated by this message that maybe is coming from social media saying, you know, we need to be giving this message out. But the reality is when we give this message to patients, they don't resonate with it. They don't understand it. They don't take it on board. They don't process it. And what I want to do today in today's training is start to dissect why that might be happening, okay? So please don't take this as a way that, in any way, that pain neuroscience is a waste of time. It's an absolute very, very important part of my treatment process, okay? But what I think we can do better as clinicians is actually start to understand why this maybe isn't as effective as it could be. Now, the first thing that I want to touch on is, before I give someone this information that is going to be ultimately going against their belief systems, okay, I have to have built trust, okay, a connection with the patient and some kind of authority. Okay, now I don't mean authority as in where we're going to boss them around, etc., but have some good standing where that patient trusts that I'm a person that's going to be able to help them get to where they want to go. Okay, now the trust and the connection is a big thing. Okay, now the other big thing that I see a problem with is this mindset, and I saw this with a particular therapist, is even how he said it to me is, when I challenge the patient's beliefs. Okay, so again, for us as therapists to be going into that scenario with a mindset that we're going to challenge the patient's beliefs, personally I think that's setting us up for failure. So what we should be doing ultimately is we should be finding ways to explain effectively. Okay, so explanation, it's a skill. Explanation is a skill that I certainly wasn't taught in university. Okay, explanation is a skill that takes practice. Explanation is a skill that there is more than one way, okay, to get that explanation across. And that's very, very, very important to understand. So rather than challenging the person's beliefs, what we need to do is to understand how are we going to help this person to understand via effective explanation. Now, explanation, as I said, there's a step-by-step process that some people use. There's more than one way to skin the cat. Okay, but first and foremost, I think changing your mindset from challenging the person's beliefs, okay, because to me, when someone says I'm going to challenge their beliefs, that is confrontation, okay? So subconsciously, am I setting myself up for success here? Whereas if I go to that patient with the intent of actually helping that person understand what's going on and giving them the best shot at understanding this with my effective explanation, then I see things I see the outcome very, very differently. Now, my own explanations of what's going on, okay, are very, very simple. And I will always, and I won't apologize for this, I will always sacrifice accuracy for understanding, okay? Sacrificing accuracy for understanding. Now, that's not to say I'm giving them false information or wrong information or anything like that. But I'm not worried about being 100% accurate with what I'm saying once the person gets the understanding of what I'm trying to achieve. Okay, now that's very, very important to understand. Okay, so a lot of my explanation for that patient will be going into detail about the motor adaptations or the movement habits that they've now acquired as a result of their previous injuries. And the amount of neuropain science that I will go into it will pretty much go along the lines of something like, the area of the body now that we have this pain experience, okay, is doing a very, very good job for you. For that's almost doing too much of a good job. The tissues are getting a little bit grumpy or whatever. They're sending the signal up to the higher centers a little bit more louder than they would like to usually. Okay, the higher centers are getting a little bit agitated, and then ultimately we've got this conscious experience of pain, okay? But what I've done before that is I've helped the person understand why these tissues are acting like this in the first place, okay? And once we start to link that back to the person's story, what I get 9 times out of 10 is that makes sense, and it's almost relief. And doing it this way, it gives something very, very good, okay? It changes the person's relationship to that area of the body, okay? So if I think that lower back is doing too good a job, okay, all of a sudden, I'm telling them that that lower back is actually doing a great job for the person. Your knee is doing a great job. It's absorbing a lot of load for you every time you walk, every time you run. But what we need to do now is we need to get the other parts of the body doing their job so these tissues aren't going to get overloaded, okay? So once we start to do that, we can reframe the actual, their thoughts and beliefs about that body part without even challenging them. Okay, so I didn't have to challenge them, I just had to explain effectively in a way that they could understand specific to their story, okay, and it makes sense to them, okay. So that's something that I just want you to consider the next time you find that maybe your pain science explanations weren't effective. Is, are you focused more on trying to challenge their beliefs? Are you actually focusing on helping that patient understand, okay? And then the final thing that I want to bring your attention to today is that you may not have this pain science explanation until maybe 1 or 2 sessions in with some patients, okay? Because if you don't have that trust, that connection in that first or second session, then is that person ready to hear it from you, okay? Do they trust you? Okay, are they going to process that information? And then the final point that I want to make is that person in the right state to hear the explanation? So in that first session, a lot of these persistent back pain patients, certainly that come into the clinic here, they're in extreme sympathetic dominance. They're in fight or flight. There's a massive amount of noise going on upstairs. Okay, they're not processing information very, very well. So before I even worry about the pain science explanation, we have to understand and we have to ask ourselves the question, is that person in an appropriate state to actually process this information in the first place? So if you don't get around to the pain science explanation in the first session, that's okay. Okay, so it's not all about just saying it for the sake of it. It's about picking your time and making sure that the explanation is effective for the patient to understand what you need them to understand in order to get that ideal outcome. Okay, so I hope this helps. Next time you have a problem like that, hopefully this will be of value. As I said, I spend an awful lot of time in the therapist mentorship going through how to explain effectively. Okay, so I've spent a lot of time personally studying this, and that's something that I spend a lot of time in the mentorship. We've got actually covering it a lot in week 1, and I actually do a bonus mini course in helping people understand why explanation breaks down or why it may be successful. Because if we can get that explanation across well in the first session, the patient notoriously will follow through with the treatment plan, okay, which they ethically need. They won't drop off treatment. That's not only good for your word of mouth reputation, but it's also very, very important for your business when you're building a private practice and you need your patients to follow through with their treatment plan. Okay, so as always, thanks for listening. If you want to know more about the 90-day therapist mentorship to work more closely with me, you can either click above or below the button or below the video here, there'll be a button and I'll give you more information.